Hello, good morning, everyone. Apologies for starting a bit late. That's about 10 minutes late. I'm sorry about that. I had a little difficulty setting up my laptop. I don't know if you can hear me. If you can hear me, just let me know on the comment section. Thank you. All right, you can hear me. Thank you very much. Okay, today we are going to do case studies. I don't know if you can see the screen. If you can, I'll really be happy to know that. Let me know in the comment section too if you can see the screen. Class, this is most likely the last live stream we'll have um, for HND. So I think I can. Those of you who are who are flying in the night to make me feel bad for making you come online. So this is the last live stream for your class. All right. So be happy and rejoice. I'll come to the class again for revision. I will do I'll do revision or maybe some case studies that we may likely expect in the class, in the exam, or in the test. Not test or test is sorry, test has been taken care of in the class, and then we can all learn. I'll just let you know the selected case studies for you to study, focus on for exam. All right. So that's that for that. All right. So let's dive in. So case study one: during evening duty, a student nurse is instructed to clean a patient's bedside area after urine spillage. She pours bleach into a bucket that already contains ammonia-based floor cleaner. Ammonia-based floor cleaner, what I told you in class is a good example is quack. Quack, okay. Example is quack. Um, Quaternary ammonium-based compound. All right, within minutes, a strong irritating smell fills the room. The nurse begins coughing and experiences eye irritation. All right, occurred? What dangerous chemical reaction occurred? Then, what are the early signs of exposure to chloramine gas? So that goes on to say that the chemical reaction that occur is ammonia and sodium hypochlorite that gives off chloramine gas. Chloramine gas has a very strong odor and smells. So it means that some persons may not understand this, and then when they are cleaning, they can mix bleach and quark together, which is quaternary based ammonium compound. And when they mix them together, it gives us a bad odor. Now, this goes on to say, sorry, I know it's not related. It's a little bit related in the sense that some of you mix several body deodorants and perfumes together. I don't know if you understand. And some of these, exactly what is happening here can also happen there. Some of them can leave some very severe skin reaction. Some can leave a pungent odor that you may not know, you may not be aware. So when you're using deodorants, using topical creams, you're using anything at all, just know that those things are chemicals, and depends on which is which, they can react to give something very toxic. All right. So number three, why is chloramine gas dangerous to patients? And okay, number four, what should be the nurse first action after noticing the fumes? What nursing safety measures should be prevented? So those are the five questions, class. So let's go back to number one and two. I've answered number one. Number two, what are the early signs of exposure to chloramine gas? Chloramine gas will lead to coughing, persistent coughing, and then eye irritation. All right, eye irritation. Because of the pungent smell, it definitely leads to shortness of breath because the air is polluted. Oxygen saturation will reduce. All right, so those are the early signs of that. Then number three, why is chloramine gas dangerous to patient? Chloramine gas is dangerous to patient because it can lead to reduced oxygen saturation. You understand? It can also cause persistent coughing. That coughing is as a result of the irritation of the respiratory tract. All right, and that can be very dangerous. Okay, so especially in patients where they are ICU patients, where they are currently on oxygen mask, then recovery units, all right, labor ward, antenatal, SCBU, special care baby units, all of these things can be a problem if it's not properly managed in these wards. All right. Number four, what should be the nurse first action? All right. First action is to ensure proper ventilation because the gas is temporary, isn't it? You ensure proper ventilation so that that gas can leave. If there is a good ventilator system, can turn it on. You understand? Then stop cleaning and um, use a different chemical to wash off the area or water, most likely water to wash off the area. All right. So, what nursing safety measure would have prevented this incident? What nursing safety measure should have prevented this incident? What should have prevented the incident is basically do not mix disinfectant. And then when you are repackaging disinfectant, ensure you properly label. Because some hospitals, because they deal with industrial quantity of disinfectant, this industrial quantity will require the nurse or the person in charge to redistribute and repackage. So they may have to serve it into 25 liters, 5 liters, 10 liters containers. And these liters containers may have previously been used previously be used to package different disinfectant. Some of you in your homes, the container you put Dettol is in Lacacera bottles, Coke bottles, and bottles that have different labels. So what you're going to do if you are in a nurse or in the hospital, in a nurse in charge of disinfectants, all you have to do is remove the label, remove the initial label, so that it will draw caution to the person who wants to use that packaging in the future. And they say, oh, the label of this bottle is missing, so it definitely means this liquid is something else. What exactly is in this bottle? I don't know if you understand. So, for example, if you see a Coca-Cola bottle that the content is dark like Coca-Cola, but the label is not there, except you trust the person who has packaged that in package that bottle initially before you be able to identify that, oh, what is inside is Coca-Cola or something else. All right. So that is that for that in that case study. All right. Case study two: a nurse aide attempts to remove stains from a toilet in the isolation ward. Isolation ward can be tuberculosis unit, HIV and AIDS recovery unit. It can be bones unit. All those are isolation wards. Okay. This live stream is currently for HND class, all right? It is in the message that 6 cohorts and ND class will start by 7:45. All right, so just read the message, you will get all the information you need. Thank you. So a nurse attempts to remove stains from a toilet in the isolation ward. After cleaning with bleach, she adds vinegar to increase cleaning power. You understand how things go, how people feel that adding different disinfectants can help or make it cleaner, make it better on the rest. All right. Shortly after, a greenish yellow gas is released, and both the nurse and a nearby patient complained of difficulty breathing. Question: what toxic gas was released when bleach? What toxic gas was released when bleach was mixed with an acidic cleaner? Okay. Why is chlorine gas particularly dangerous? All these my questions are giveaway, but you know that it's not going to definitely be like this in the exam. It's not going to be like this in the exam. Number two questions, you will be seeing the answer of number one there. Better read. It's not going to be like this. So when I give you case study, I tell you this case study is the AOC. The case study is the AOC. Study the case study among yourselves. It doesn't mean the questions in the case study in the video is going to be exactly the question. No, it's not going to be. I can assure you that. Even the revision I'm going to do in class, the case study questions I'm going to ask is going to be different from what you see in the exam. But you know, when you study a case study, there is hardly any way the lecturer can extend questions if you study it. I don't know if you understand. So if you study the questions thoroughly, you study the case studies thoroughly rather, you know every possible questions within your syllabus that the lecturer can ask, no matter the question you see. For example, in the previous case study, where we did a patient mixing bleach and quack. Imagine I ask you, um, what? Imagine you say in the exam, what is the measurement? What is the concentration for using bleach to remove urine spillage? When you are studying that case study, you're supposed to know. You're supposed to, oh, bleach is mentioned here. Let me know all information about bleach. I don't know if you understand. Quack is mentioned. Let me know the concentration of quack that is used for urine spillage. I don't know if you understand. So that's how to do case studies. Just take the case studies and ask yourself any random question that can come up from that case study. That is how to do revision. And that's how I'm going to do revision with you. But just know that these questions are quite simple. Probably because I just want to save time. So why is chlorine gas particularly dangerous in enclosed hospital spaces? Number three, what symptoms may develop after chlorine gas exposure? Number four, what immediate nursing actions are required? Why should acidic cleaner never be mixed with bleach? So we have seen that the problem here is basically bleach. I don't know if you understand. So the problem here is bleach. So what I would advise you to do when you leave this case study or when you want to revise for my, if I tell you, for example, disinfectant and antiseptic class slide is going to be part of your AOC for the exam. All you just have to do is take this case study and read. And then because I highlighted bleach in case study one and case study two, it means that bleach is a disinfectant of importance. So know everything about bleach. That is how to read. That is how to prepare. Instead of not reading a quack, instead of not reading every other thing that is in disinfectants, you have streamlined your reading to what? To bleach. You understand? So if I give you about 4 or 5 subtopics like that, and most of my case studies are no more than 2 or 3. Okay, so that's about 10 case studies that you're going to revise for 30 marks. My part is going to be about 30 marks, my colleagues 30. So that is almost like giving you the whole 30 marks. All right, if you know what you are doing. All right. So that's that. Let's answer this case study quickly because of time. So the toxic gas that is released, I've mentioned this chlorine gas. Why is chlorine gas particularly dangerous? Well, the chlorine gas evaporates very quickly. All right, very quickly. So if chlorine gas is released, for example, in the provost office in an admin building, it can get to the boss's office in about 30 seconds or 40 seconds. It's very light, you understand? So it's like is very light and it causes severe irritation. Okay, so and those irritation are not just temporary as the irritation from chloramine gas in quack with that's when you mix bleach and quack, chloramine gas is released, isn't it? Now we are mixing bleach and a different substance, vinegar. Vinegar is also a disinfectant and is releasing chlorine gas. Now chlorine gas will stay longer in the lungs and cause inflammation of the lungs. You understand? Why chloramine may cause irritation, but will not cause that inflammation. So a patient that is asthmatic will react to this, and maybe it will restrict their airflow. Depends on who you are. You can take that as a slang, or you can take that as a side effect or a contraindication. So chlorine gas can restrict airflow. All right. What symptoms may develop after chlorine gas? Cough, shortness of breath, skin irritation, eye irritation, and those are respiratory symptoms. So in case you run out of ideas, once you know that it can cause inflammation of the lungs, any symptoms that come to your mind that affect the respiratory system, you are good to go. All right, what immediate actions is not required? evacuate the patient's area. Now, in the first chloramine gas, you don't need to evacuate because proper ventilation, everybody will be fine. Now, evacuate, especially if you have patients who are recovering from respiratory diseases in that place. All right. Then evacuate, then increase ventilation. Those are the few things that should be done. So why should acidic cleaner never be mixed with bleach in a healthcare? All right. Now, acidic cleaners or basic cleaners, quark is a base. Um, Vinegar is an acid. All right. So acidic cleaners, basic cleaners should not be mixed because why? They will release of salt and water. All right. They will release it off, or they will release what? A gas. All right. And those gas can be poisonous and can be life threatening. You understand? So know this at your fingertips. If you have questions, just keep asking. I will address them as we go on. All right. So lastly, the last case study we are going to do for this disinfectant is after disinfecting a bedside, a bedside table with bleach. You see a bleach again. All right. So it's master then should know what to do with sodium hypochlorite. So after disinfecting a bedside table with bleach, a nurse immediately wipes the surface with an alcohol-based disinfectant. So we have bleach with what? Quark, bleach with vinegar, and bleach with alcohol-based disinfectant to make it dry faster. So who can give me an example of alcohol-based disinfectant? Can give me an example of alcohol-based disinfectant? Please exchange in class. Please, when you do so, just let me know your name. Just state your name and then write it alongside. Success, don't want you. You're telling me to go over the previous case study. Wow, are you just arriving? Um, I may do that. I may not. Just pay attention to what I'm going to say going forward. So, spirit, Clement, thank you very much. Clement, please. Spirit is a broad term. Spirit can be alcohol. Spirit can be liquor. Spirit can be plenty things. All right. You would have just typed your name and the word together. All right. Esusa, thank you, methylated spirit. Christus, methylated spirit, HND. Is that what I say you should do? Princess, pay attention to details. Write your name and all right. So, methylated spirit, thank you very much. Thank you very much. So, thank you for mentioning that. So when I mention alcohol-based disinfectant, all of you have an idea. That is the point. If you don't know what alcohol-based disinfectant are, when you finish this class, get up, go to a pharmacy, tell them you want to buy. Thank you, blessing, Omonigo, hand sanitizers. I was actually looking for that. Ochuko FA, thank you, hand sanitizer. All right. So what is the major problem with mixing bleach and alcohol-based disinfectant? So in that case, let me tell you what happens. Bleach will reduce the effectiveness of what? Of sorry, alcohol-based disinfectant reduce the effectiveness of bleach. All right. Although it's going to produce gaseous substance anyway, but the effectiveness is compromised. You will not have any kill effect. No disinfectant actually kill about 99%, but not all. So you will not have the kill effect from the bleach. You understand? So that's that. What is the harmful substance? I mean, from chloroform. Chloroform is what comes out, what forms. All right, chloroform is what forms um, when you react alcohol and bleach. All right, all right. Chloroform is explosive. Chloroform is. Let me see the next question. What is the contam? Why is this combination unsafe in patient area? Chloroform is explosive. So someone that is smoking cigarette now in that place can actually cause an explosion. You understand? And you know, sometimes the hospital, there may be need for burning, there may be need for incinerating something, although it is controlled, but you don't know what will happen. A child can come with a lighter, all right, and the nurse just finished cleaning with bleach, now added alcohol-based disinfectant. That's a good, and this explosion is not just it does not have to touch any earth surface. It's from the air because it's a gas. All right. Then what is the correct nursing practice when switching disinfectant? When you are switching disinfectant, the point is allow the surface to dry. You can use multiple disinfectants as much as you like, but allow that surface to dry. Let it be done without first disinfectant. You understand? Uh-huh. Then you can clean properly with water before you use another one. But you are supposed to use only one disinfectant at a time. There's no point with which you need to mix them. All right. So what teaching point should be emphasized to nursing staff? So never combine disinfectants. So as a student, because the questions are going to come as you are a nursing student, so what are you going to tell your nursing staff in case your nursing staff is telling you, please let me go and mix those two things there. I want to use to clean this thing. This blood is too much here. You should be able to educate them and tell them why it is not smart to do what to mix disinfectant. Adiba Yosayo, you are late to the party, but thank you very much. All right, thank you very much, everyone. As the HND class now, I'll begin the next class shortly. These are all the questions. So I remember I sent your class a proper assignment for you. The assignment is going to be submitted on Monday. Now, the reason for that assignment is for me to have a documented proof that you understand what you are doing about the questions. If you do not do the assignment, it's fine. It's not a problem. You know, I've never disturbed anybody. I've never disturbed anybody in for assignment before. So, excuse me, somebody says, sir, please come again with number 5. What teaching point should you emphasize to nursing staff? Let them not mix disinfectants. All right, they should not. That's the teaching point. I don't know if you get that praise. All right. However, this is a recorded video. If you miss anything, you can scroll back and check it. Okay. All right. So write the assignment, submit. The assignment is going to be due by 10 a.m. I told your class at 10 a.m. It's either it's in my office by 10 or in your class by 10. Either of the two, the assignment drops in my hand. I'm not going to collect it after class. I'm collecting it before I start if I am in your class. I'm not going to collect it past 10. I'm collecting it by 10 if I am not in your class. So maybe you should start leaving your class maybe at 9:50, 9:55, so that before you walk from the class to my office, it should be 10 so that I can collect it and quickly document it. All right. So please remember to do the assignment and do it today and tomorrow so that you'll be able to submit on Monday before 10 o'clock. Thank you very much, HND. I will send your class rep the link because this is a multi-purpose live stream. I don't want to drop the link here. I don't want HND, ND and the RON to go and start filling the link. I will drop it with your class rep, Daniel, and any other of your HND class rep class numbers I have so that they can quickly put it on the class group. Thank you very much and see you on Monday, hopefully. Bye. So you can exit the stream now so that the sixth cohort and HND can start. Hello, good morning, sixth cohort and ND2. Hope you're fine. If you can hear me, please let me know you can hear me. Thank you. If you can hear me, just state you can hear me, please. Thank you very much. Can you hear me? Can you hear me? All right. Thank you very much, Osare Koi Odion. Princess the best. God bless you. Choice Uchizi. God bless you. Fave. All right. So today we are going to do 4 case studies. We're going to do one on patient and patient education, and maybe 2 or 3 or 4, depends on my mood, on on um, on toxicology. All right, Mrs. Grace Okawa, 35 years, small business owner, medical history, hypertension, on amlodipine 5 milligram. All right, so let's see presentation. Miss Okawa comes to the clinic with complaints of persistent cough and feeling generally unwell for the past 5 days. Generally unwell. Someone says she can't hear me. Can you hear me, everyone? No, master. Can you hear me? Please state if you can hear me, please, before I leave. I shall continue. Okay, thank you very much, everyone. So during history taking, she mentions, "Nurse, I have been taking antibiotics that I bought from the chemist. I have some leftover amoxicillin from last year when I had cough, so I started taking that. When it didn't work after 2 days, I went to the pharmacy and bought ciprofloxacin. I have been taking both of them together for 3 days, but now I'm not feeling better. I also take ibuprofen when I have headaches, which is almost daily now. On further questioning, she takes antibiotics when she remembers, sometimes once, sometimes twice daily. She's been taking ibuprofen 400 milligrams 3 to 4 times daily for the past 4 weeks. Blood pressure today is 160/95. Temperature 37. She admits she sometimes forgets her blood pressure medication. So identify 5 problems. 5 problems to Miss Okafor self-medication practice. Who can tell me one problem that you can find here? Just write it. Write your name and the problem you can identify. Hurry up, please. So I'm waiting. Who can identify one problem? One, resistance to antibiotics, RODA. Resistance? I don't really know. Did she have an infection? Occupation, small business owner, hypertension, on amlodipine. Okay, she comes to the clinic with complaints of persistent cough and feeling overall generally unwell for the past 5 days. So where did you see infection there? Rhoda, I think that antibiotics should be wrong drug. Do you understand, Rhoda? Let me highlight your comments that you see it. It should be wrong medication. All right, because she actually do not need some of the antibiotics she's taking. All right, so these are things you're going to be doing in the exam. You are going to be studying case study as if you are treating a patient, and that is the beautiful thing about case studies. So you have to know how to think outside the box. So just like what I told the HNA class, when you are revising, let's say I tell you this is an exam question, take this case study and read it. Understand what it means by the case. Understand everything about this case study. Because I may not set exactly these questions you are seeing here, but the case studies will be the same. The things you are seeing in this case study will be carbon copy. If I tell you, for example, that this question is going to come out, this case study is going to come out. But the questions under it may not be the same. Because what I want you to do is that you are supposed to read that, know the case study, know every possible question that can come out. So it means that you should have a large knowledge base about patients' drug interaction, patients' drug consumption, drugs that they should not use together. You should have them because I told you I gave you this list in class. I think this was one for your class, ND class, that's on Thursday. So So, self-medication, God bless you. All right. Then explain why taking antibiotics for a viral cough is inappropriate. So I told you many upper respiratory tract infections are caused by viruses, not bacteria. And I told you that you see the likes of amoxicillin and ciprofloxacin. They are classification of antibacterial drugs that are usually known and referred to as antibiotics. Remember I mentioned this in class. So amoxicillin and cipro are antibacterial, but most times cough syrup and respiratory tract infection are viral in nature. So, what is the likely reason her blood pressure is poorly controlled today? Explain the interaction between ibuprofen and antihypertensive medication. So, I mentioned that NSAIDs and cardiovascular diseases and cardiovascular drugs do not work. I told you in class, drugs should not take together NSAIDs and patients who have hypertension. All right. God bless you, Jomo Shedrack. Polypharmacy, not compliance to medication, and taking ibuprofen for headache. Yes, PCM, unnecessary drug. All right, PCM is important for the let me highlight this comment. PCM is important for the headache because PCM doesn't fall under NSAIDs. You understand? And then it will not cause any reaction with her medication. But she opted for ibuprofen, which can be a problem. All right. So, verse number 4: develop a comprehensive patient education plan addressing self-medication, that's A. B. When to seek professional help. Medication adherence for hypertension. What is he just trying to tell you? He's trying to tell you what is the nursing consideration you're going to tell her that will make her reduce self-medication, that will make her know when to seek professional help, that will make her know when to stay with her medication. So those are normal things that you should be able to know and you should be able to do. All right. So for self medications, you will just tell her the kind of OTCs that she should buy. Say, madam, you cannot be buying ibuprofen over the counter because over the counter you have hypertension. Don't buy it again. Instead, you should buy paracetamol. Don't buy antibiotics by yourself again. You understand? Instead, go to see the doctor so that they will do a sensitivity test for you. All right. Check expiry date for drugs because you mentioned in the question that there was one drug she took last year, and that drug she had to take the remaining one this year. So there's a chance that drug may be expired. All right. So those are the things that you want to tell her. They want to seek professional help. You tell her if your symptoms continue after 2 to 3 days, go to the hospital to go and see a doctor. All right. If you have difficulty breathing, chest pain, go to the hospital. Then for adherence, encourage her to stick with her antihypertensive medications because she says she does not remember taking them and she does not take it every day. You can tell her to set an alarm. You can tell her to have a relative to call her. You as the nurse can be calling her. All right. Because you will do that freely for a guy. I'm talking about a female nurse. Sir, you are too fast. Wow. Princess Best. Princess Best, show yourself. If I come to class again, please show yourself. All right, I'll reduce my speed. This is how I talk normally in class now. Or is it that maybe I'm rushing because my data will soon finish? It's okay. As well. My data will not finish. Don't worry. But that's not why I'm rushing, okay? This is how I talk normally. Yeah, laughing, Rhoda. God be with you. All right. So toxicology is what we're going to do. We are done with patient education. We're done with patient education. So we are going to go into toxicology immediately now. Toxicology is where the real meat is, okay? Where the real stuffs are. But patient education, you see just start from one question. That one question has exposed so many things. All right. So please pay attention and also pay attention. Also ask questions. If you have any questions, collect my number from Benjamin or Nancy. I think Nancy has my contact, and send a direct message. Okay. So, case study 2, toxicology, paracetamol overdose. All right. Name Miss Blessing Eze, 19 years, university student, or probably college or nursing student, but I doubt. I don't think any of my students will try to commit suicide with paracetamol. I haven't listened to my class, and I told you how slow the death is. Do you understand? All right. So let's move forward. Blessing is brought to the emergency department by her roommate and how painful it is. And I also told you how it is unnecessary to commit suicide. It is not necessary. You can seek help anywhere, anytime, okay? And help will be given. I don't know if you understand. All right. So, where were we? Blessing is brought to the emergency department by her roommate at 6 a.m. Now, class, when you see 6 a.m., there's so many details. When you look at the case study, you should be very, your eyes should be very, your mind should be broad. So you are saying 6 a.m. There's the high chance that this reaction or this problem started the previous night. So there's already 12-hour gap. Maybe it started by 5 p.m. in the evening yesterday, started by 9 p.m. in the night. They could not come to the hospital because it was dark. They were trying to manage it, give oil. I know people usually engage in self-care, but they eventually bring patients to the hospital. So those of you who are here, oh, somebody said peace. On day you buy for me. All right, good. Please, Daniel, whosoever knows peace, please ensure you give me a number on WhatsApp. All right, you cannot hide from this responsibility. But it's fine. Thank you very much. I really appreciate it. Okay, so you have to understand that some things are you have to imply so many things when you're looking at the case study. And you know that those of you who are going to be working in the hospital, I was about to say that you are going to be seeing the worst of the worst patients. Nobody likes to check into the hospital to do simple symptoms. You first of all call your mother to tell the symptom. If your mother gives you solution and it goes, you are okay. But sometimes your mother house does not work. That's why you see, oh, there's a lecturer that is also a pharmacist in my school. You will chat him up and tell him. If whatever he prescribes for you doesn't work, that's why remember time is already going. So before this patient can eventually not want to go to the hospital, it's about maybe 1 week or 2 weeks after he starts feeling symptoms, and there's a chance of deterioration. There's a chance of many problems. It happens like that too for poisons and toxicology. When patients consume poison, the people in the streets, give him water, give him erosion water, give him dry sand, give him bitter leaf, give him this, give him that. They're already trying to treat without taking to the hospital. So there is already like 1-2 hours delay, and you know what happens after 2 hours? Every absorption has taken place. So the roommates comes by 6 a.m. The roommates states that Blessing took a whole bottle of paracetamol tablets at around 10 p.m. You see, in the night. After an argument with her boyfriend. Wow, who is this person? Who is Blessing in this class? Who is Blessing in this class? Please, I need to know her. Oh, somebody said you know. Okay. All right. Blessing, please do not consume paracetamol. All right. Um, the bottle contained approximately 20 tablets of paracetamol. Each total dose 10 grams. Somebody saying, "Oh no, Blessing, are you that petty? Why do you call?" Thank you very much, Blessing. I'm sorry, it's not you. They are not talking to you. Well, I'm going to use Princess best name in my next case study. So she complains of nausea and has vomited twice. Sweating profusely, appears lethargic that she's weak, but oriented that she knows what she's doing, but she's weak, but she knows who's talking to her. Oh, this is the doctor. Let me see your one finger. Let me see 2 fingers, 3 fingers. How many fingers are these? She knows how to do all of that. All right, appears lethargic but oriented. Denies suicidal intent. Now says she just wanted to stop the pain. You know, when people want to die, all they think is death. But when the death start coming, all they think is life. That's how life is. So please, class, do not think of suicide, no matter what happens to you. You will always work out of every challenge. Even prisoners that they give life sentence, when they go to the prison, they become president of their prison, senators in the prison, and they become influential there. To die is to end all chances of survival, and it's very cowardly. I've spoken so much about not committing suicide, especially in sixth course class. Spent almost 1 hour of my time doing that, and a few minutes of my time in ND class. So please, nobody, I don't want to hear anybody in my class thinking about it. If you have any difficulty, always reach out to me. Apart from finance, we'll look for the solutions together. All right. Vital signs 110/70, pulse 98, which is normal, temperature 37, respiration rate 18 per minute. So what? Question 1, calculate whether this is a toxic dose of paracetamol. Show you're working. Good. Should we reach out to you if you have suicidal thoughts? Yes, you can reach out to me. Although we have a college counselor. And she does a lot of work. When I was director of students affairs, she helped a lot of students. I referred so many students to her, and she treated them properly. She's licensed. Just anyway. When you come, I will take you to her. But you can come, we'll talk. If as soon as I hear, I will try to refer you to her. Okay. But if you want to, if you have, you can also reach out to her. Her door is always open. And then if you have need a contact, you can reach out to me. I'll give it to you. So any of them. So calculate whether this is a toxic dose of paracetamol. Sure. Okay. So she calculates. She consumed how many tablets just now? They mentioned 20 tablets of 500 milligrams. So 20 times 500. I will give you the number of milligrams that should consume. And the bottom line dose is what? 10 grams. So describe the four stages of paracetamol poisoning. I think I gave these stages to the class. If I did not give your class, maybe I didn't give the ND class. I am sorry. I am sorry. I am sorry. So stage 1, 0 to 24 hours, which is nausea, vomiting. Stage 2, 24 to 72 hours. All right, which is the period where the patient feels better. All right, it's usually the very deceptive stage. This is where the liver damage occurs because liver is trying to survive in this stage 2. Stage 3 is the top, the this is where this is the height of liver toxicity, acute liver failure. All right, that's stage 3. Then stage 4, this is the stage of death. All right. So usually from the fourth day, that's the stage 4. All right. Fourth day, stage 3 is 72 to 96 hours. Stage 2 is 94 to 72 hours. If you do not hear me, please rewind this video and listen. All right. So no, I'll put change that to you. Okay, fine. Shedrack, you can reach out to me. It's not a problem. All right. So, all right. Thank you, Favor. Please, can you type it? Okay. 10th stage 1, 0 to 24 hours. Let me see if I can look for my material on this and post it on the comment section so that we can have an idea, because I think I have a question about this on the questions on the Excel sheet, the Google form questions we are going to answer. So class, I've posted it. All right, different stages. So it's scattered, just for to arrange it. All right. So what stage is Blessing currently? Blessing is currently at stage 1. All right. She's vomiting, nausea. That's where she is. All right, sweating. Stage 4, question 4. What is the specific antidote for paracetamol poisoning? That is N-acetylcysteine. N-acetylcysteine. All right. So how does it act? Which makes your action. I'm not going to ask you generic brand and brand names. So I'm not going to ask you that. This is like, I think I have HND still doing this topic. That's why I had these questions there. So, N-acetylcysteine. Mechanism of action is that it destroys the metabolites from paracetamol. All right. What paracetamol metabolite does is that it consumes glutathione, and this antidote replaces the glutathione level in the patient. All right. So I've learned the immediate nausea management for Blessing. So basically, what you just do, there's no need, because this patient is still within the 8 hours. All right. You want to also give activated charcoal. No, activated charcoal is not necessary anymore, except the patient comes in around, let's say, she took it by 10. If she comes in by 12 or 1 in the midnight, you can give activated charcoal. All right. Then you can give the antidotes and give fluid. All right. After administering fluid, the time for discharge, you discharge her into psychoanalysis units. That is, you do not discharge her, let her go home. You take her, let her go to Uselu. We all know Uselu in Benin, isn't it? Something like that. You can say, please, don't take her home, let her go and see a mental health doctor, so that if she argues with her boyfriend again, she will not go and take something that is harmful. All right, second case study. Mr. Chukudi Wanko, 42 years, occupation farmer. Mr. Wanko is brought to the emergency department by his brother approximately 2 hours after accidentally drinking from a bottle of diclovos, which is sniper. The brother reports that he mistook it for water. It was stored in an old soft drink bottle. I told you, okay, this is HND class. Do not repackage disinfectants. Many of you in your houses, you store Coke bottle, Izar, you store Dettol in Fanta bottle, Sprite. The day your eye will be turning you and you are hungry, you are tasty, you may not know it is what it is. You may store them, remove the labels. Remove the labels. When you do that, remove the labels, remove the packaging of the Sprite. Those That's a tiny liner that is wrapped around it. Then put it where it's out of reach. Maybe in the store or in the restroom. You understand? So on examination, patient is restless, confused, excessive salivation, drooling. Remember I told you sludge? Sludge is the acronym for the symptoms for organophosphates, and sniper is an organophosphate. All right. Tears, sweating profusely, as vomited 3 times, password rich stool, blah 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 blah. Question: organophosphate poisoning presence with a characteristic syndrome using the mnemonic sludge. Identify which symptom Mr. Nwakwo is exhibiting. Yes, Sharon, Frederick, he will smell it. He will smell it, but sometimes your nose can be a very, very partial judge. You know, many persons have mouth odor and their nose not tell them. That's what happens sometimes when when you are where the sense of smell is very, very much limited. If somebody is hungry, he may he may be sensitive. He may not be sensitive to taste or to smell if he sees something that he wants. For example, yes, he has lost sense of smell. It can be said that he has lost it, but he has not. When you're walking, when you're hungry, when you're tasty, when you're drooling over something, when you're drooling, saliva is coming out of your mouth, it may not necessarily come out. All your mind is in that thing, and you're not aware. Have you not seen people who unknowingly drop their baby on the ground, or people who their phone is in their hand and are looking for it? That is exactly. It doesn't happen routinely, but it happens sometimes. The brain can just misbehave for just that 10 seconds. That 10 seconds is enough for him to consume a lot. I have a relative who had consumed kerosene. Kerosene was in a Coke bottle, you understand? And then he just consumed it, thought it was water. All right. It was dropped somewhere carelessly in the kitchen, and then saw it or maybe somebody did not finish drinking it. But he had already consumed a set to a certain level before he realized. So it was either very tasty or he was trying to rush to drink somebody's mineral soft drink. And he was more conscious about not being caught than conscious about the content of the bottle. So anything can happen. I don't know if you understand. So it's not when you're in the A and E section, you're not saying, "Oh God, what did they do yourself?" You don't get sense, you will lose your license. It doesn't even make sense. When you work in A and E, you will see terrible things people do. You understand? When you work in A and E, your nursing with your nursing and your whole life will flash before your eyes. You see a lot of things. A lot of things that is not you think it's not possible. You see it. You understand? And those things, how you compose yourself matters a lot. Don't shout for your patient. Don't say, look at what you're saying now. Somebody said he has lost the sense of smell. Don't go and say that, bro, when you see somebody rush to the hospital because he ate raw beans. He swallowed 100 pieces of raw beans, then they hung on his chest. And you're like, why? You don't ask why at that stage. You look for solution. Before later, you can now, if you care, you can now say, oh God, what happened? Why were you eating raw beans? Or somebody who ate candle. You understand? And having stomach trouble. Why? You understand? Not like the person has a history of mental illness. Why? All those things can come to mind. All right. So those are the symptoms I mentioned. So use that sludge to respond to that answer question. What is the mechanism of action of organophosphate poisoning? Organophosphate poisoning will definitely cause what you call drooling, salivation. Um, it inhibits a particular enzyme of what's the name of this enzyme? Acetylcholinesterase, or also known as that is used to produce acetylcholine. All right, acetylcholine is broken down by acetylcholinesterase. I will type it on the comment section. Don't worry. It inhibits this enzyme. I don't know if I mentioned it in class. And one of the things I told you case studies will do for us. One of the things I told you case studies for us to bring out things I did not mention in class. So acetylcholinesterase is the enzyme that organophosphates inhibits. All right. You understand? Um, so what then happens is that acetylcholine will accumulate in the body. All right. It leads to cholinergic stimulation. All the symptoms we are seeing here in the sludge, salivation, lacrimation, urination, defecation, GI upset, and then excretion. all of those things are cholinergic stimulation. So there's so many cholinergic in the cholinergic stimulation in the body. That's why you see the person crying when he doesn't want to cry, salivating when he cannot control it, urinating when he cannot control it. Do you understand? Too much stimulation. All right. So solution is atropine. That's the antidote for it. Although there's a new antidote, I don't know if I mentioned it in class. I doubt. Let me type it here. There's a new antidote, pralidoxime. This can also be used. All right, can you see it anywhere? That's is it. Then name two specific antidotes. That's it. Outline the immediate nursing management priorities. What is the nursing management priorities? You position patient very well. All right, oxygen therapy. All right, then you just I told you about ABC, airway management, decontamination. You understand, and then um, airway management, decontamination. There is ABC, breathing and circulation. So when we are talking about airway management, you're going to ensure this patient is positioned properly to manage breathing. Oxygen is prepared for this patient. Then decontamination, remove the clothing of this patient. All right, wash the body of the patient because, of course, cholinergic stimulation also occurs in the skin. All right, uh, because absorption of these things can be from absorption of sniper can also be absorbed from the GI tract down to the skin, and that one is even dangerous. So you just wash the body. So usually they put this person under shower, not the head to suffocate the other part of the body, and they wash continuously. All right. They use activated charcoal. I think this patient, I think the question says within 2 hours, isn't it? So activated charcoal can also help um, um, as it can also help reduce absorption. You understand? All right. So what was the question? What other question? So I don't understand that question number one that you explained. Number one question. Okay, organophosphate present with characteristic system. Sludge. I gave sludge in the class now. I gave the full meaning of sludge in the class. Okay, didn't I? If I did not if I did not give it, let me know. I think I gave it. All right. Okay, somebody is asking killer bees. Killer bees. Oh, killer bees is just bronchospasm and bradycardia. Bronchospasm and bradycardia. That's the killer bees. That is the things that will eventually kill the patient. So it is what's happening in sludge that eventually leads to bronchospasm and bradycardia. So I've commented it in the comment section. We will see it now. All right. So, okay. So what other question somebody asked? I think I don't know if I missed any question. If I miss a question, please just say it again because the comments were much. Antidote is atropine and pralidoxime. I mentioned that. Are you not paying attention? More for one faith. All right. Outline the immediate nursing consideration. I've done that. So what's ongoing monitoring is required? And develop a community education to prevent similar incidents. Please, did I mention about sensitization? Okay, but let me talk about question 5 first. Ongoing monitoring. You monitor vital signs, you monitor his consciousness, monitor respiratory rates, monitor the intake and output of fluid. So you will be doing urinalysis, you will be doing urine output measurements, you will be checking for respiration. So let me just list them properly for you. Vital signs, you measure respiratory rates, you measure urine input and fluid input and output. Because remember that this patient is drooling, urinating. That's loss of fluid, a lot. That will eventually lead to bradycardia. So that's what we're trying to eventually kill the patient. But if you are doing none of that, treating, you have to measure the improvements that they are having. All right. Then community education plan. Proper storage of pesticide. Safe handling of application. You're going to teach the community how to recognize poison. If somebody is poisoned, what to know? They will start bringing out saliva from the mouth. They will start vomiting and sweating. All right. Then first aid an emergency response. You teach them ABC, what to do. All right. So basically the antidote is exactly the opposite of what the poison is doing. So because of time, let's quickly wrap up with this last case study. Mr. Okonkwo is brought to the emergency department unconscious by police who found him collapsed in the public toilet. Empty bottles of codeine containing cough syrup and tramadol were found nearby. So I told you opioid is also a class of drug that are poisonous and can lead to. No, he's not experiencing all the symptoms of sludge. The case study stated the symptoms he's experiencing. The case study mentioned the symptoms he's experiencing. You understand? Not everything. I don't think he was experiencing defecation because it's just barely 2 hours he took it. So you be able to identify which of the symptoms in sludge he is experiencing. So let's leave that. So a physical examination, unresponsive to verbal stimuli, response to only painful stimuli, skin is pale, all right? Then vital signs, the rest, respiratory assessment, the rest. One, case study, question one. Identify the classic triad of opioid toxicity. All right. First of all, when you're going to identify patients that have opioid toxicity, they will have miuses. All right. That's the widening of the black of the eye. Do you understand the pupils? Then respiratory rate will be very low. Patient will be breathing very slow and sometimes very loudly. And there's decreased level of consciousness. So we are going to check the triad question for opioid toxicity is what? Dilation of the pupils, which is meiosis, then respiratory depression, then decreased level of consciousness. All right. So once you can identify these three in a patient that is brought to your emergency unit, you will know definitely this is an opioid toxicity. All right. So question two. Question two, what is the most immediate life-threatening problem for Mr. Okonkwo? And all of them are life-threatening, but you see that respiratory depression may likely kill the patient faster. You understand? So respiratory rate is very low. All right. So that can actually kill the patient. So the antidote for opioid toxicity overdose, I told you, Paul, I think the class chorused it when I'm asked it, naloxone. If you don't know it here, you should know it. All right. And naloxone is given within 1 to 2 minutes, it start having effect. The patient can become awake as soon as you administer the injection. It's very fast. So naloxone is part of emergency medication that you should have in your hospital. So when you are working in a pharmacy or in a hospital, you should definitely check your emergency medications to know. You should definitely check emergency medications to know what, to know the medicines that are there and the ones that are absent. So nursing management. Outline the immediate nursing management and priorities. Basically, you just assess for airways and breathing, then monitoring the vital signs after the antidote has been administered. All right. Then check for complications. Those are the three. All right. Just check for complications. Airways and breathing. You assess the oxygen level, check oxygen saturation, and administer naloxone. Then monitor after the antidote has been given. Check for vital signs again. Check for level of consciousness. Then check if the pupil is reducing back to normal. Then check for any withdrawal symptom like sweating, nausea, then agitation. The patient is agitated. All right. And this last question that I asked here. Okay, develop a brief patient education. Develop a brief patient education for preventing future overdose. Okay, that is normally basically under patient education. All right. What psychosocial issues should be addressed once Mr. Okonkwo is stable. You just assess his substance abuse and every other thing that has to do with using opioids. All right. If the person is dealing with pains, you can just ask and address the pains. All right. Thank you very much, everyone. I appreciate your time. So, class, this is most likely the last video you are going to see this semester. Last live stream. If you pay attention, you know that my voice is already cracked. I've been talking for the past 1 hour. I don't like stress. It's a good way of living. So, for those of you who have been saying health education, Mario Sewelly, you want to stress me? All right, Mario Sewelly. So, somebody said, "Sir, please come again for the classic triads." You can replay the video, please. I'm tired. Classic triads are basically these classic symptoms to use to identify patients who are on naloxone, who are on opioids abuse, you understand? Dilation of the pupil, respiratory depression, and please remember the last one that I mentioned, decreased consciousness. No, patient is not conscious. All right, so this is the last live stream we're going to have this session. And I'll come to class and give you AOC. I'll tell you the areas where you will need to prepare. And when I give you a case study, please ensure you don't cram the questions under the case study because the questions are going to be different. Is that clear? The questions are going to be different. Oh, sir, you told the questions are going to be different. And then what I need you to do is I need you to ensure that I need you to ensure you understand. I need you to ensure you understand that you understand the case study. Sorry for the distraction. I need to ensure you understand the case study. So take a case study, study it very well. Ask yourself questions on that. You can put it in ChatGPT to give you more questions on that. So you'll be able to have an idea what other question I can set. So what I'm going to assure you here is that no case study you're going to see in your exam is new. You are going to see this thing. All the case study that I'm going to set, you're going to see them. All right, we are going to see them, and you are going to see all the case studies that I've set. That is, sorry, I'm distracted. Somebody just came to talk to me here. What am I saying? I'm saying that the case studies that you're going to see in the exam, all of them must have been taught on a live stream. However, you're not going to see the same questions that were answered in the live stream. So if I tell you now, class, when I come to your class, let's say this week or next week, depends on the free period you have for revision. When I come to your class and say, class, this revision, this case study, do antiviral case study 2, then I say toxicology case study 3, go and read that for your theory exam, and then you see it in the exam, you will see the same case study. However, the questions we answered here today, you may not see them, or you will not see them. I'm assuring you that. Why is that? I want you to just go to the case studies and understand the case study, so that when I now ask you, for example, I didn't ask at this stage the dose of naloxone. I didn't ask. All right. Then I ask the dose for paracetamol antidotes. But you should know that. So when you are studying the case study, study the case study and everything the case study mentioned. You understand? Have an idea what it is. Understand the questions that was answered there, and then ask yourself more questions that may likely come out. That is how to read the case study. And usually when I will do that for all my theory questions, and that will be about 30 marks. So if I tell you the case study, that's about giving you 30 marks, or maybe say 25 marks. If you don't really know what you're doing, you should get 25 over 30 in that part. Plus your CA, plus my other colleagues' parts, you should have been trying to get a B plus or an A in pharmacology, which I know. I didn't mention the doses, yes, of course. Once I tell you everything, you get to know the doses by yourself. All right. Okay, so that's that. So that's that for that. I will drop the link to this class on your individual class groups, and then you'll be able to see them. Thank you very much, and see you. The person who promised me a time, remember, I'll come to your class on Monday and fish you out. All right. God bless you. See you guys next week or whenever I can come for revision. Bye bye.